All right, so I've started the recording. Welcome to today's discovery session on scenario-based learning with H5P. My name is Emily Rush, and I'm an instructional designer with Citi. And what I'm going to do today is talk a little bit about the practice of scenario-based learning and also demonstrate how to use it with H5P, which is a tool that all of the Citi designers can use to create interactive scenarios, and they're all very well versed in creating a variety of types of interactive content. And before we really get going, I just want to note that in order to be mindful about the time that we have scheduled today, I'm going to try to keep the formal portion of this discovery session to about 35 minutes because I want to allow plenty of time for discussion and exploration. So as I'm presenting, I welcome you to put questions in the chat, and my colleague Lynette is going to be helping me out in monitoring the chat. At any time, though, if you ever have difficulty seeing or hearing any part of the presentation, or if it seems like I'm just not making sense, please unmute yourselves and just let me know so I can clarify myself. I would hate for you to walk away not fully understanding what I'm trying to convey. So in general, what my plan today is to talk a little bit about a specific tool that can help facilitate the creation of interactive scenario-based learning. But I also want to touch a little bit upon the learning science behind why scenarios-based learning works so well. So it will be sort of a combo of theoretical and practical applications. Near the end of today's discovery session, I'm also going to demonstrate a scenario, and then later after that, I'm also going to put a link into the chat for a Canvas page that has additional examples that we can look at together or that you can explore further on your own. All right, so my goals for the session today are to, first of all, explain some of the benefits of scenario-based learning. And if some of you have already used case studies or unfolding case studies, you're probably aware of some of these, but I just want to make sure we're all on the same page. I'd also like to demonstrate an example of scenario-based learning using this specific tool, H5P. And then what I think is important about this session is I'm going to talk a little bit about how scenario-based learning can be tailored to Rush University students, and in particular students who maybe are still in the initial, if I can say, pre-professional stages of their career, because scenario-based learning needs to be a little bit different for learners at that stage. I will briefly outline the best practices for creation of scenario-based learning. And then I'm also going to talk about the development process that you would go through if you're working with a designer to create scenario-based learning. All right, so before I really get into the nitty-gritty of what is scenario-based learning, I just want to make sure that we're all familiar with the tool that I'm talking about, which is called H5P. And this is a content creation tool, and it's something that all of the designers on the Citi team have access to. And what makes it so exciting is that it allows designers to create a variety of interactive learning materials, not just scenario-based learning, which is the focus of this discovery session today, but we could do different kinds of content like crossword puzzles, drag and drop, hotspots, and a variety of other things. And very importantly, the content that we create with H5P integrates really well into Canvas. And later on, I'll show you examples of scenarios that have integrated into assignments, discussions, as well as a Canvas page. And it also, even better, is that we can set it up so that if you have graded assignments created with H5P, that they populate and migrate right over into the gradebook really seamlessly. So it makes it easier for you. In terms of some of the other options for H5P, you can have a variety of multimedia elements. So I'll show you an example that has primarily image and text, but depending on what you and your designer decide, you can also have audio and video elements. So it can be really rich in terms of different kinds of media. Okay, So, what is scenario-based learning? And I wanted to sort of start here because I think a lot of us are familiar with the concept, but different disciplines tend to use different terms. So, from my kind of perusal of scholarship, it looks like clinicians might tend to use terms like unfolding case studies, or problem-based learning, whereas designers like myself typically call it scenario-based learning. And that's what I'm going to use when I'm talking about the practice throughout this discovery session today. I think what everything has in common is that scenario-based learning, unfolding case studies, it's really a problem-based approach to learning and to passing on content to students. And what this means is that with scenario-based learning, what we often encounter are interactive activities that ask participants to make a series of decisions. And these are cumulative decisions, and that's one of the things that's so important and so powerful about scenario-based learning, is that at multiple stages, students can start to see some of the results of the consequences of each individual decision. And in that sense, earlier decisions will then affect what choices are available later. And this will become clear. If it's not clear already, I think it will become even clearer when I demonstrate an example that I have shortly. Okay, so in terms of then, why would you want to use scenario-based learning? I think there's a number of reasons that you'd want to. First of all, I think it's a form of authentic learning. And so as such, it really does a great job of helping promote critical thinking in your students. It also can really help them to develop task analysis and problem-solving skills, which is something that I think regardless of what area of the university your students are studying in, these are areas that we want to foster. Very importantly, it could also provide a safe space for high-risk situations. And I'll use this term high-risk situations a few times throughout today's discussion. And it can mean a variety of things. It can mean a clinical sort of life or death scenario, but on the other hand, it can mean just a really important conversation that, if we think about when a conversation goes badly, it can also have really bad consequences. For students who routinely use scenario-based learning, it can also build their confidence in a way that other learning activities may not be able to replicate. And from my understanding, scenario-based learning can also help prepare some learners for revised medical or health sciences board exams. All right, and if you bear with me, I'm just going to very briefly talk about some of the learning science that tells us why scenario-based learning works so well. And one of the first reasons that it works so well is due to the storytelling element. And if you think about it, if someone tells you a story, you're more likely to be involved or to listen and remember or be able to respond in a particular way than if they show you a PowerPoint, which unfortunately I'm showing you a PowerPoint. So my apologies for that. But in terms of why it works so well, storytelling can really work to increase motivation and engagement within learners. It also brings about a kind of a greater emotional involvement in learning content, which directly correlates to memory. And so storytelling involvement in terms of emotions can trigger memories, especially if we are part of the story or we become immersed in it. Additionally, storytelling can be useful in that it can provide additional context for learning experiences to get learners this kind of fuller sense of what's happening. And finally, it can also reinforce feedback in a more authentic way through situational learning. And one more point in terms of the learning science of why scenario-based learning works so well is a concept called productive failure. And before you want to jump off the call and run away, I'll say that, of course, no one wants to fail. No one wants their students to fail. But learning science and training practices have shown that failing in a safe environment and developing problem-solving strategies in that kind of controlled space can actually be quite productive. And so when I think about productive failure, what I mean is that learners are presented with a challenge in a safe and controlled environment. And this often might be in contrast to direct instruction. And within this environment, then learners can explore concepts, they can think about consequences freely and confidently without severe repercussions that they might face in the outside world. And it's because of this opportunity that they can make mistakes that it can help them actually increase their understanding and also more readily transfer that knowledge to other learning contexts, which helps them avoid similar errors. If you still don't like the term productive failure, that's fine, I get that. Another way we can think about it is with the phrase desirable difficulties, which also comes from learning science. And desirable difficulties, it tells us that difficulties are desirable because they help with knowledge organization and retrieval processes that support learning, comprehension, and remembering. So no one likes it, but it is important. All right, so that's a little bit of the background of what is scenario-based learning and some of the learning science about why it's such a powerful form of learning. So what I'd like to do now is show you an example of a branching scenario in H5P. And in this case, we're going to be looking at a scenario involving diagnostic reasoning. I will caution you that I created this example on my own, and I'm not a clinician. Despite that, though, I think it's a good example of what you and an ID can accomplish together if you collaborate to create a scenario that is embedded in H5P. And I also want to stress that scenario-based learning can be used for a variety of content types, not just diagnostic or clinical content. So let me move my screens around. And I'm going to go into my sample page. And hopefully, Lynette, can you see a Canvas site now?
Yes, I can, Emily.
Great, thank you for confirming. Okay, so this is an example of a scenario that I've built with H5P. I've included a few instructions outside of H5P in Canvas, and I've embedded it as an assignment. I tried to make it pretty low stakes, so it's worth about 10 points. And what the learner would do would be to read these instructions that would give us some background about how to move through the assignment. I tell them it might take 15 to 30 minutes. I'm not going to take that long to move through it this morning. And then I will load the activity. And you can see I've done the activity many, many, many times. Okay, so this is what it looks like, H5P, when it's in Canvas. And we'll begin by starting the course. And I'll say a few things about the style of the material before I actually get into the content. So the style of it is very customizable, as I said. I chose to keep it sort of minimalistic in style with some text and some images, because really the overall appearance of the activity is actually secondary to the scenario's authenticity and the authenticity of the feedback. So that's really what I wanted to emphasize for this demonstration, but you and your designer can make all sorts of choices about the appearance and the flow of a scenario. Okay, so we'll turn to this diagnostic reasoning case stem. And here we encounter a 73-year-old man who comes in with some lower extremity pain. And we learn a little bit about he doesn't really have a lot of other symptoms. And so we'll proceed and we encounter our first question. And this is not a requirement, but something I like to do to make this very user-friendly for students is to make the first question a very low stakes question. Here I've asked them, are they ready to get going or do they want additional instructions? Just so they can see what the question process looks like without having to make a high stakes choice for their first question. Here, for the sake of time, I'm going to say, no, I'm ready to begin. All right, so now we encounter a little bit more information about Mr. Summers, including the initial examination. And once we peruse that examination, I'm going to select proceed. And if I'm going too fast, I hope you'll tell me that. This example is available in the sample site that I will give you access to in just a few minutes. Right, so we have a second question. And again, a clinician might not consider this a choice or question, but we're going to decide whether or not to examine the patient further. And we're going to examine the patient further and look at his lower extremities. Right, so on further examination, we see that the patient is experiencing some warmth on his foot and calf, and he also has some decreased foot sensation. So at this point, we're going to start making additional decisions about his treatment, and we'll decide whether or not we want additional lab work or we're going to request radiographs. And here I'm going to request radiographs. And this next set of text and choices, we find out that the radiographs don't reveal any evidence of a fracture or a foreign object. So we need to think about what is the next best step in the patient management. And we can request an ultrasound, an MRI, we can prescribe an oral antibiotic, or we can test serum uric acid levels. And here I'm going to go with prescribe an oral antibiotic. And I apologize, this is a little bit wordy slide, but basically it tells us that since the patient has a history of diabetes and he has some peripheral neuropathy, that it's possible that he might have cellulitis. So it's perfectly reasonable at this point to try a course of oral antibiotic. That's sort of the summary of this slide. So we're going to do that. And we give Mr. Summers a 5-day course of oral antibiotics for presumed cellulitis. And we ask him to come back in 1 week. Unfortunately, when he comes back in 1 week, his symptoms are not getting any better, and his pain is actually worsened when he walks. So that leads us to our next decision. We're either going to take additional patient history, or let's say we decide to perform a skin biopsy. In this case, I think that Mr. Summers has an antibiotic-resistant infection, and I'm going to perform a skin biopsy. Right? And basically, what just happened is I reached the end of a branch, and basically the end of the scenario as I've designed it. We get a score that tells us that we didn't accurately complete the scenario, but more importantly, we get feedback that says that there's really no evidence of a progressive or uncontrolled infection. So that particular diagnosis is not very likely. And then we have the option to restart the course. And if we were to restart the course, we could go through a different possible branch or get different possible answers. I'll pause for questions in just 1 second. I just want to show you what this looks like from the back end. So this is that same scenario from the designer's perspective. And I've created a legend on the left, just so you can see sort of what each piece of information means from the design perspective. So the dark slides are the slides that were telling us information or background about the patient. Every blue rectangle is a decision point. The blue circles are decision options. And there are different points in the scenario where you could be redirected to an earlier point in the scenario. And all these little red flags are a terminus to the scenario. So that's where you reach an end, regardless of whether or not you get the right answer. So a couple of things that I hope you'll notice here is, first of all, that you can see that there's a number of multiple possible pathways through the scenario. So in a way, this education is very customizable in the sense that you and your designer can make it look at any kind of different possible configuration you can think of pretty much on the back end. But it also means for the learner that it's really kind of a personalized form of learning because they can choose a variety of different pathways. Additionally, whether the learner proceeds through this left branch or right branch, there are really only about 6 key decisions through the scenario. And according to everything I've read, that's about the optimal number of decisions for a learner at the undergraduate or graduate level. You can certainly have fewer decisions and make a mini scenario, and those are great. If you have more decisions, though, it can get a little bit complicated, and you may want to break those up into multiple scenarios instead of one sort of very large scenario. All right, I've been talking a lot, so I want to pause and see if there's any questions from the chat or anything that I might clarify.
Well, there's no questions for the chat. You can feel free to ask somebody if they want to make a question or statement in person using their microphone.
Yeah, okay. Ricky had a question, thanks. So usually about 6 questions is what I've read is optimal, especially for learners who are not actively working in their field. And keep in mind that my first question was, did you want to see the instructions again or not? So, maybe 6 or 7 is pretty good. And sure, thanks, Ricky. Any other questions at this point?
So this is Tyler. Just to clarify, so six or 7 questions, and then in terms of, is it always just 2 options? Like the question is do this or that, or can you have more than the 2 questions within more than 2 options within the question?
No, that's a great question. You can actually have as many as you want. Okay. I think the most I decided over here, there's a question with 4 options. Okay. It seems to me more than that, and it would get overwhelming for the learner. Right.
And then another question. I know you mentioned that you can have images, audio, and video in this, and that's any, if you have an MP4 or something, it can be so like I have a bunch of videos of ultrasound or ventilator waveforms, it could be integrated into the scenario.
They can definitely be integrated, yes. The one drawback is when we have a decision point, there's the multimedia has to be on the information slide, which is a black slide. But yeah, you could put an MP4 and that would be great. Thanks. Other questions? All right, I'll keep going because I know I want to be mindful of time. So I want to say a few things about what works well for scenario-based learning. And these are 4 kind of guiding principles as you may be thinking about your learning content and how to incorporate. Okay, Mary Beth had a great question, and I will get to that shortly. How long does it take to set this up? So don't let me forget that, but I promise I will come back to it. In terms of what works best for scenario-based learning, ideally, you would have at least 2 to 3 elements that I have on the screen for scenario-based learning. You don't need to have them all. And what I mean by these is, so a scenario should have multiple consecutive decisions that build upon one another. These are decisions that you really want them to have consecutive rather than isolated steps. Secondly, very important, you want to have strategic skills involved. And so these are skills that might require judgment or tailoring, as well as probably a deeper understanding of concepts. And also, as I've said before, but I'll reiterate, you want to have skills and decisions that emphasize the consequences of an action. A third element is things that work really well for scenario-based learning are tasks that might involve shades of gray. And what I mean here is something that might require some aspect of nuance. Some examples that I can think of maybe are difficult conversation or customer service examples. Like there's not always a clear-cut right answer, but there's some nuance. And then again, the risky situation of elements. And this can mean, as I said, clinical situations or difficult conversations or a whole range of things in between. Also importantly, anytime we're thinking about scenario-based learning, we want to set up decisions that represent good, better, and best options. And when we're thinking about that, we want to think about where are learners most likely to make mistakes And especially when we're thinking about novice learners, where are they most likely to have difficulty? And just thinking back to that concept of productive failure, we don't want learners to encounter obvious wrong answers or detractors. That's sort of the opposite of productive failure. If you fail, but you fail by selecting an obviously wrong answer. Okay, the other thing that I think is particularly important about scenario-based learning is how do we think about how to customize it for pre-professional learners is what I'm going to call them. If I'm using the wrong term, though, I hope someone will correct me. So for people who are have high level of expertise in their field or are already working in their field, scenario-based learning can accelerate your knowledge and skills from someone who's been in their field from like 2 years to someone who's been in their field to 10 years in a very short time. It doesn't work that same way with students, though, so we have to keep some different considerations in mind. And the first is for designing scenario-based learning for students, it works better when we use it to assess existing knowledge and skills. In other words, it doesn't work so well when you try to impart new knowledge and skills into a scenario. That kind of entails a really high stress learning curve. Scenario-based learning for students also works really well, though, for influencing attitudes or behaviors. And for, I don't know, I'm not an expert in what you all do, but some examples I can think of are communication about gender-affirming care or conversations about trauma-informed care. Those might be ways that you influence attitudes or behaviors. It also works best as part of an iterative process rather than a single isolated case. And some ways you can do this are to increase the duration in which you cover a case in course. You might provide different kinds of scaffolding in terms of pre or post scenario for your students, or you might use a few scenarios scattered throughout the course of your semester. And the last thing I'll add about this is that I think scenario-based learning is probably more effective when you use it as a formative assessment rather than summative assessment. And I see a comment from Ricky. Iterative just means sort of repeated. So I don't think it's probably the most effective thing if you just do one scenario per course, because especially if it's a really novel kind of learning activity, it'll benefit your students, but I think it will likely benefit them more if you do a couple of scenarios throughout the semester. Okay, great. All right, now let's get to Maribeth's question. I didn't forget about you. So in terms of the collaborative design process, and it does need to be collaborative, as you might have noticed from the scenario created, I'm not a clinician, so there are some things that I would put in there that a clinician wouldn't. So you want to work together closely with a designer, and I'll say that each designer's process might be a little bit different, but this is sort of an overview of what that process might look like. Initially, you probably want to have a conversation, either email or meeting with your designer, and you'll discuss a case or problem that interests you, and you'll decide if it's right for scenario-based learning. Once you've decided on what scenario or case you'd like to develop, you'll start outlining the objectives. You will maybe sketch out your scenario and sort of note what would be key decision points throughout this process. From there, you'll then flesh out the scenario, and what you want to do is really outline the best option for each decision point. And what I mean by this is you'll want to sort of map out, if a student did everything perfectly from beginning to end, what would it look like if they took the ideal way pathway through the scenario? After you're happy with point 3, then you would add the good and better choices to your decision points. Then you would test and deploy your scenario. And really importantly, especially if it's a new kind of interaction you're bringing to a class, I highly suggest that you gather feedback from your students just so you can get a sense of how effective the scenario went, and if you might consider making changes, or maybe you want to create even more scenarios. And I will say that this is sort of what the process would look like. The timeline would certainly vary depending on what you would like to do and your designer's availability. But if you're interested in creating scenarios for fall, for example, I'd suggest that it's probably better to reach out to your designer at your earliest possible convenience, just so you could get the conversation going. All right. Now, the last thing I want to do before I really open it up to more questions or exploration is to share with you a site that has more examples. So let me put that link in the chat, and you can self-enroll. Okay. Okay, so I put a link in the chat, and if you select that link, you should get a page that looks like this. And once you do that, you'll want to enroll in the course. And I'll just pause for a minute while people are doing that. And please, if you're having any difficulty getting enrolled in the course, feel free to unmute yourselves or put something in the chat. Okay, so as you are entering the site, this is just a sample site that I've created for this scenario-based learning session. And on the homepage, there's a variety of things that you could look at, including select bibliography if you're interested more learning about some of the studies that I looked at in terms of undergraduate and graduate learning, as well as best practices. But right now you might be more interested in the sample scenarios. So there's a sample scenario 1 is the sample scenario through which I walked you through one branch of diagnostic reasoning. The second example is a scenario-based learning activity that I tried putting into a discussion forum. So that's just a different way to deliver the content. This is an open educational resource H5P module that I was able to locate, and it's about therapeutic communication. And so here you could have students, you could create a prompt for your students. You can put the scenario in the discussion. And what I did was set it up so that students would take a pass through the scenario and then write comments in the discussion forum. So there would be a discussion about the scenario. I think this could work particularly well in an asynchronous learning environment, but of course it could work well for a variety of courses. And then the other way that you might consider using a scenario is you can also embed it in a Canvas page. If you do this, however, the grade doesn't transfer directly into the grade book, so that would certainly be a consideration. And I've been talking a lot, so what I want to do is just first of all tell you some next steps if you're interested. And we do have time, so I'll be around for questions. But if you are interested, I would urge you to contact your instructional designer if you're already working with someone, or city@rush.edu. If you have specific questions about this presentation, about some of the learning science behind scenario-based learning, or you'd like to work with me, please feel free to email me at emilymrush@rush.edu. I'd like to thank you for your time. And what I'm going to do now is I'm just going to stop the recording, but I will be available to answer any questions if you have any. If you don't have any questions, please feel free to keep exploring the site.